Good morning, everybody. Welcome to Coffee with Stacy. We're coming to you this morning from Westside Bagels, which is on Coral Ridge Drive, just north of the Sawgrass Expressway. I told you last time, this is my favorite bagel shop in all of Broward County. It also happens to be in the district I represent, so that makes it very convenient. The phone number here is 954-755-4600. And if you're going to call, make sure you ask for Howie. Howie makes the best catering stuff.
Got it.
Hands down, no questions asked. As always, if you want to contact me, my email is sritter@broward.org, and the phone number is 954-357-7003. As I've told you before, we're going to take this opportunity to tell you what Broward County does for its residents, some of the services that we provide. So this morning, we have our Human Services Director, Susan Myers.
Good morning.
Who lives in Fort Lauderdale and says she feels like she's in another world. Broward County's big.
It is.
It's very diverse.
Here.
It's very diverse. See, this gives you an opportunity to see something a little different.
Yes.
We are actually probably, well, not actually, but I always say we're closer to the Gulf than we are to the Atlantic when I'm this far west. So we're going to talk about some of the things that Broward County does for its residents.
Okay.
I think we'll see where the conversation goes. Susan, when did you come to Broward County?
A little over 2 years ago.
From?
Alachua County, Gainesville. Go Gators. I had to get that in there.
Okay, we're done for today. Thanks for being with us. That's okay. If you want to do the... Yeah, I'll go like this. I believe that FSU had the #1 recruiting class in the nation in football last week.
Okay.
Okay.
Congratulations.
So let's move on from there so that we can continue to have a pleasant conversation this morning, and we'll fight each other when the camera goes on. We won't. So, first of all, how'd you get to Broward from Alachua? What made you decide to come to this huge...
Well, I love South Florida. I grew up in Florida. I love Florida, and Broward County, in my opinion, has a phenomenal array of social services, and anybody in this business would love to work in Broward County because there's just so much that we offer here, and I'm very proud of what we offer. I know my colleagues around the state, and I have to say I'm in a position now to brag about what we do.
That's so nice. And I think that one of the reasons I do this is so that we can brag about the things that we do, because you won't read about it.
No.
So talk about some of the things that, first of all, what's your budget?
We have $80 million in county funds, and then we bring in another about $45 million from the state and the federal government.
So you're looking at $120-some-odd million.
That's about $135 million.
Okay.
My math must be off.
Okay, well, the more the better.
Yes,
the more the better.
yes.
And how have you been cut, if at all, these past 3 years?
Well, we've had significant reductions, primarily from our direct services. We have direct service programs, which means that we actually have staff, social workers, case managers, counselors who provide services to the community, and then we also have contracted services that we provide funds to our private nonprofits to provide services. And so over the last 3 years, we have lost about 250 staff. Wow. Of county staff.
And those are things like social workers, caseworkers, people
Correct.
who actually do one-on-ones with the clients.
Yes, we've had some reduction in our direct service staff, case managers, but we've had some. We're really trying to be more efficient, so we have had a lot of administrative staff. So the last couple of years, we've tried the best that we can to have reductions without diminishing services to the community. Although there has been some reduction, the more the budget crisis goes on, the more the community will feel the impact.
And it always seems that the impact is felt most by those who can least afford to take the hit.
Yes.
And social services, human services always seem to take this big hit because they're a large part of what we do, and yet those are the people who need the services most when the economy goes south.
Yes, and I think there's a myth, particularly coming from another part of the state, that South Florida is very wealthy and everybody down here is wealthy, but that's not true. That is a myth. Yes, there is a certain segment of the population that's fortunate, but there's another segment of the population that is not. And we have a lot of working poor, so to speak, in this community, and they're the people who are in the service industry. They tend to make minimum wage, and it's hard for them now to make ends meet.
So let's talk, like, I know you've got tons of different programs and services, and as we go through the series of YouTube coffees, we're going to have some of the heads of those departments and agencies talk more specifically about what we do. But give me the names of 4 programs that we do in Broward.
I will talk about BARC, which is the Broward Addiction Recovery Center, and it is the largest substance abuse program in the county, and we have several services there. We have a detox program, 34-bed detox, where if your loved ones, family, friends, you feel as though they have a problem, they can come in and be assessed, and then if it's determined that they need assistance, they can go into the facility for detox services, which is anywhere from a couple of days to a week.
And how's that paid? If you can't afford it, how is it covered?
Well, it's a sliding scale.
Okay.
From very low to no cost up to, it's based on your income.
Mm-hmm. Okay.
Then we also have residential services. We have a 92-bed residential facility, so once somebody has completed the detox program and they still need services, they can go into our 30-day residential facility. Actually, it's in Coral Springs. And then after they're discharged from residential, after they've successfully completed residential, we have outpatient services. We have some intensive outpatient services, which are half-day. People are in treatment for half a day, and there's some in the morning, some in the afternoon, because we want people to work. Mm-hmm. And then we have some, it gradually dwindles down to maybe only need to come once a week.
And do you know how many clients you serve in BARC?
I wish I knew the answer.
Okay.
It's thousands.
Wow. That's just... And I don't think most people know about that.
It's thousands.
Hopefully you won't have to personally know about it, but just to know that it's something that Broward County does for its residents who are in need. So give me something else.
And so, let me just touch on that a little bit. Substance abuse touches most of us. If it's not a significant other, it's somebody in your family or a coworker. It's not just a stranger out there. And one of the issues that we're seeing more and more of now is prescription drug abuse. It's not necessarily people standing on the corner buying drugs, but they just go to their local pharmacist and buy drugs. So it's a significant problem that touches all of our lives, and we're here to help.
And the pill mills,
exactly.
Which, of course, Broward, unfortunately is one of those statistics where we're leading the nation, where we don't want to lead the nation, is one of the reasons why they're so easy to come by.
Roughly about 40% now of our population are prescription drug abusers.
Wow.
Yeah. Mm-hmm. Of the population that we serve. So that's BARC. We also...
It's just prescription drug abusers. I mean, we're not talking about illegal drugs. We're not talking about marijuana and cocaine.
Correct.
And, we're talking about pain pills.
Exactly.
Somebody who gets addicted to these drugs could be... the perception is that it's somebody who's homeless, who's on the street, who's begging. It could be somebody living in a really beautiful community who has a problem.
We work with a lot of families, middle-class, upper-middle-class families who have exhausted their insurance, so to speak, and they have nowhere else to go, and they come to us.
Wow.
So we serve a lot of people. Another program that we offer is called our Family Success Centers. We have 4 Family Success Centers around the county. South, we have one in Coral Springs,
yeah.
We have one in Pompano, we have one in Fort Lauderdale, and we have one in Carver Ranches in the south. And we have a satellite center in Davie. And this is our program where we assist people who need help with their rent utility payments. A lot of the dollars that we get come from the state. We've had a significant amount of stimulus dollars to serve this population, but we also have about $6 million in county funds. And there is an eligibility process, and we ask that people bring in documentation. It's all online, or you can call one of the Family Success Centers, and they will tell you what to bring in, and we will assist with your utility payment or your rent or mortgage. And the main function is to prevent homelessness. We don't want people to have to lose their homes. And that, as you know, there's been a significant problem with that of late.
The district office, my district office is in the Family Success Center in Coral Springs, and we see the population coming in, and they just do an amazing job. The staff there does an amazing job. Actually, we're going to take a break, and then we're going to come back. We'll talk to you just a little bit more. We'll be back.